Good morning, this is Ravdeep. Today I will be demonstrating the IV fluid and medication and administration skill video. So the first step is to go into the patient's room, provide patient privacy, close a curtain, introduce yourself to the patient, verify the patient using their name and date of birth, ask them if they have any allergies, and then go over the procedure. Make sure they have a good understanding of the procedure, answer any questions if they do ask you any questions, and then the next step is to perform hand hygiene, and then you would want to put on clean gloves. And then before I begin this procedure, I would just like to go over the materials that I have. So I have my primary fluid bag right here. I have my secondary fluid. I have the primary fluid tubing. This is a spiking that will go directly into the fluid bag. This is a drip chamber in which I'll be able to visualize the amount of fluid that's in there. This is the tubing in itself. This is what you would inspect to make sure there's no air bubbles. If there are any kinks, you would want to fix that. And then we want to make sure it's clamped for now. This is the port that is connected to the secondary piggyback line. We want to make sure that this is sterile at all times. And then this is the part that is connected directly to the patient's IV. This is my secondary tubing that I have. It has the same components as the primary tubing, the spiking, the drip chamber, the clamping, the tubing in itself. And then I have my red label. This is what we will utilize at the end of the procedure. It will be placed onto the IV fluid bag, and it just lets the oncoming staff and you know when the infusion was started. Of course, it has the patient's name, the type of drug, amount, a room number, and then you would put your initials and the date and the start time as well as the expiration date of the fluid bags. So the next step in the procedure is you would want to confirm your orders with the MARS, so I've already done that. And then I've grabbed my primary fluid bag, which is normal saline. I want to make sure that it's the correct fluid, the right dose, and then I want to make sure that there's no holes or tears in the bag itself. We also want to check the expiration date to make sure it's not already expired, and if it is, you would discard it and get a new one. So what you would do is you would turn this towards you so the red cap is facing you, and then we would twist off the cap. So it is off, and then we will grab our primary tubing, take off the transparent cap, and put the spiking into the fluid bag. And you might have to twist and turn a couple of times to make sure that it's secure. And then we would flip it over, and then we will hang this 30 inches above the patient's IV. Okay, so once that is hung 30 inches above the patient's IV, we want to make sure that the drip chamber has fluid in there halfway. We want to inspect the tubing to make sure that there is no air bubbles or kinks, and if there are, you would make sure that you get those air bubbles out. And then the next step is to confirm the accuracy of our calculations. So our primary order was 150 mLs of fluid per hour times drop factor 15 GTTs per minute. So after my calculations, I got 37.5 drops per minute, but obviously we can't give 37.5 drops, so you would round that to the nearest whole number, which is 38 drops. And then once you confirm there's no air bubbles in the tubing, you can unclamp it And whatever device you're using, whether that's an Apple Watch or a timer, you'd want to time your device to 1 minute, and you want to make sure that you're counting 38 drops. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31, 32, 33, 34, 35, 36, 37, 38. Okay? Then we clamp it. And then as we are doing this, we also want to make sure that we are following the 6 rights of medication administration. So you want to have the right patient, which we do, right medication, right dose, right time, right route, and right documentation. And then the next step in our procedure is to grab the secondary fluid bag. So we have our secondary fluid bag right here. And then the same steps, you want to confirm that it is the right fluid, the right dosage. Look at the expiration date. So our secondary fluid is amoxicillin. So what you want to do is you want to turn it over towards you, so the red cap is facing you, and then the same steps, we would twist off the red cap. It is off, and then you would insert the secondary tubing. So you take off the transparent cap off the spiking, and then the spiking goes directly into the fluid bag. You twist and turn it until it is secure in there, and make sure you take your time with this. And then what we do is we turn it back over. But before we hang this fluid bag, we will sterilize the wide port of the primary fluid, and then we will connect that to the piggyback line. So using an alcohol prep pad, you will, over the course of about 30 seconds, use circular motions going from in to out to sterilize the wide port. And then we will connect this to the secondary piggyback line. So you twist off the clear cap. It comes right off, and then you will connect it and secure it. And once that is secured, before we hang up the fluid bags, one thing you do change is the position of the primary fluid bag and the secondary fluid bag. So the secondary fluid bag will go above the primary fluid bag. And then Again, the same thing. You want to make sure the drip chamber is filled halfway with fluid. Inspect the tubing to make sure there are no air bubbles. And before we proceed, we will again confirm our calculations. So our secondary order is give amoxicillin 250 milligrams